Welcome, everyone. This webinar is the second in a series the Alliance and partners are creating to help communities maximize all the new federal resources to end homelessness. All of these resources will be available on our website at the link Mindy is going to drop into the chat right now. We were kicked off yesterday by our president and executive director, Nan Roman, and Michelle Carver, who is the associate director of homeless and special needs housing at the Virginia Department of Housing and Community Development. So if you missed that webinar, please visit the link that Mindy is putting in the chat. Next slide. Great. All right, so today I am joined by Kelly King Horne, the executive director of Homeward, Virginia, and Fatima Smothers-Hargrove, who's the program eligibility specialist at the Richmond Redevelopment and Housing Authority. And we are so excited to have you both with us. And we're going to hear from them a little later on in our webinar. Next slide. So before we dive into the emergency housing vouchers and how to maximize this unprecedented opportunity to end homelessness, first, I should also just remember to introduce myself. I'm Kristi Schulenberg. I'm the director for the Center for Capacity Building at the Alliance, and I'm grateful to be here with you today. And I'd like to dive into a little bit of level setting before we get into how to maximize this unprecedented opportunity. So we want to review how these incredible resources fit into your ongoing goal of making homelessness rare, brief, and one time. So if you joined us yesterday, you heard Michelle share that homeless systems weren't created to really end homelessness, because they lacked funding and capacity. And some really still aren't. But because of people like Michelle and Fatima and Kelly and others like them, we know some key things about what makes a homeless system effective. So as you plan on how to utilize these emergency housing vouchers, plan as you would for all resources, making sure they are targeted and have the greatest impact on ending homelessness in your community. The next few slides are a reminder of the goals, the approaches, and practices of an effective homeless response system. And they're meant to set the stage for you to make smart and strategic use of the voucher opportunity to have an impact in your community. Next slide. The goal of an effective homeless response system is to align all system components so that all interventions are focused on the singular goal of helping people quickly exit homelessness and divert households who are imminently homeless. Communities with the best results in making homelessness rare, brief, and one time have an intense focus on housing people as quickly as possible. They utilize a system-wide housing first approach, which is helping a homeless person or household move into housing and then provide support once that person is housed. This overall approach has proven to get better results at less cost. Next slide. An effective system designs all its programs and models around that goal. And the strategic decision-making at the system level ensures that all resources, roles, and activities are centered to rehouse people quickly. Next slide. Using the emergency housing vouchers as another tool in the toolbox to ensure that people in a housing crisis have access to immediate help, including a safe place to go, that people are not unsheltered, that people do not spend long periods of time homeless, and that people exit homelessness quickly and do not quickly cycle back into homelessness can have a tremendous impact on your efforts to make homelessness rare, brief, and one time. Next slide. Every community through its homeless systems performance is trying, or should be trying, to accomplish these four goals: to reduce inflow into homelessness, to increase access to permanent housing, to decrease average length of time homeless, and to decrease the returns to homelessness. The emergency housing vouchers are among current unprecedented opportunities to make a significant impact on these important performance measures and have a real impact in your community. So how will the emergency housing vouchers help your community further these goals? Next slide. That's something that all of you are here thinking about and trying to plan for. So In order to do that, the practices that effective homeless response systems use are here on the slide. And I just want to emphasize equity as the foundation is first and foremost. And we want to ensure that, that the homeless response system is a system where all who are served have a safe and stable home. I've already raised the housing first approach. Diversion is another practice that I know many of the communities are implementing, including Richmond, and we'll hear about that. The rapid identification and engagement of people experiencing unsheltered homelessness with the goal of connecting them to housing and services. Next slide. Effective homeless response system also ensure quick, accessible, low barrier pathways to shelter and other crisis services with short stays, and rapid connection to permanent housing for all sheltered and unsheltered people, whether or not they are matched to a housing resource through coordinated entry. And the emergency housing vouchers should support these practice standards and be made part of rapidly connecting unsheltered and sheltered households to permanent housing opportunities. So that's just a little bit of a level setting and foundation of how to think about using the emergency housing vouchers in particular, what we're going to cover in this webinar, but also all of the unprecedented funds that are coming into the community. So we want to talk about some considerations for prioritization when it comes to the emergency housing vouchers. So as Nan shared yesterday, if communities manage to use the EHV funds strategically, tens of thousands of people experiencing homelessness can be housed. For the first time, we can achieve a significant reduction in the homeless population. And if you heard Michelle speak, she talked about the unprecedented opportunities that in some communities in Virginia, that's exactly what they plan to do, which is end homelessness. So to do so, we start with a set of values to guide the strategic use of these funds. And this is just a quick recap of yesterday in case you missed that webinar. But first, communities should use these funds to the maximum extent possible to reduce the number of people currently experiencing literal homelessness. These funds should be used to serve people with the highest needs because they are the most in need. And because these folks remain homeless the longest, they impact these lengths of stays impact both flow into the homeless system and create more unsheltered homelessness. The use of these funds should be focused on reducing racial disproportionality and disparities because the homeless system can reduce disparities caused by other systems and because it can also continue to perpetuate them. So communities have the potential to use their data in a way to further racial equity, and applying that information and analysis to the use of the EHVs is a concrete way to further this value. Partnerships are key to the successful implementation of EHVs, and we're going to hear about the importance of these partnerships today from Kelly and Fatima. And all of the unprecedented funding opportunities we are seeing really drive the importance of partnership, because in most cases, the homeless system itself is not the entity that's receiving these funds, but in fact needs to partner with other entities that are receiving these funds in order to impact homelessness in the community. So whether you currently have strong relationships between your continuums of care and your public housing authorities, or between your managed care organizations or your home officials in the continuum of care, things are happening fast. Roles are changing, clarity is needed, MOUs are needing to be fleshed out, and it's critical that these partnerships are valued from the get-go and a structure is further developed to ensure the successful implementation of these funds. So, as Nan said yesterday, we need to act with urgency, because these funds are for emergencies, and Congress wants them spent quickly, and we want to do that because the impact that they have on people who are living on the streets or in sheltered situation is tremendous. Next slide. So being smart and strategic about how to reduce homelessness begins with the understanding that most communities won't be able to house everyone currently experiencing literal homelessness. So thinking about who will be housed has to be smart, and it has to be strategic. It has to go beyond just eligibility. What might be the easiest administratively? It may look different than what your community is currently focused on. As a community, your thinking must be laser focused on this historic opportunity to reduce homelessness. This unprecedented opportunity brought to us by these EHVs also provides an opportunity to further strengthen current relationships between continuums of care and public housing authorities, and in many cases create a new relationship between these two entities that, when successful, has the capacity to make a significant dent in reducing and ending homelessness. Through the EHVs, communities have an opportunity to create and witness what resourced and meaningful partnerships can look like and the impact that they can have. Knowing these partnerships have the potential for long-term impact is exciting. So take a page out of Michelle's book from yesterday. It's time to start meeting with home officials. It's time to start meeting with Medicaid staff. It's time to start meeting with your managed care organizations and share these basic 101s about who you are, what your roles are, and the impact that you can have. Figure out what each of you bring to the table and leverage that to impact homelessness in your community. These entities have money and they are paid to offer services, as Nan said, to assist people experiencing homelessness. Next slide. So thinking back to an effective homeless response system, consider who to prioritize for the EHVs should also include how those decisions will impact the overall goal of making homelessness rare, brief, and one time. These include, how can the EHV support furthering your system performance measure goals? How can they provide an opportunity for households who are living in permanent supportive housing to move to other permanent housing opportunities because they no longer need the intensive supports, thus making more PSH available to those with the highest need? Consider how this opportunity will increase your system flow, how moving people out of unsheltered and sheltered homelessness quickly can reduce the average length of time between coordinated entry assessment and housing placement, not to mention reducing the average length of time someone experiences homelessness. How can these EHVs provide permanent housing opportunities to those households who are long stayers in your shelter system and reduce the overall length of time people are in your system? Think about how you can further, and in many cases, achieve the end to unsheltered or chronic homelessness. Next slide. As Nan shared yesterday, the Alliance understands that every community has a different homeless population, so the priorities will be different. But based on the values presented earlier and the HUD guidance on prioritization, the Alliance recommends using your data to create buckets or categories of strategically chosen candidates for housing. The Alliance recommends choosing categories based on need, the ability to reduce the size of the homeless population, and to reduce racial disproportionality and disparities. These categories might include people who are unsheltered, which would be a great opportunity to house people living in encampments, which you are trying to empty. People who are disabled, long-term stayers in shelter, people over 55, families with children under 6, people who are high on your existing priority list, and people who are interested in and it's appropriate to move on from permanent supportive housing. Next slide. So some additional considerations. So we're asking that the Alliance guidance on the prioritization also includes those who should be looked at in terms of a lower priority. And that includes those folks in rapid rehousing, unless they are explicitly placed in rapid rehousing while waiting for PSH or are literally about to be evicted. Otherwise, it won't reduce homelessness in your community. Most people in rapid rehousing do not become homeless again. And even though it may look like they will, they don't. Also, people who've just been quarantining in hotels and motels, unless they are a very high need, and not just because a jurisdiction doesn't want to be seen as putting people back on the streets or shelters. So these are important considerations in terms of the impact that they will ultimately have on homelessness in your community. Next slide. As Nan also shared yesterday, and in case you missed it, we want to stress that EHVs not be used to prevent homelessness. And by this, I mean homelessness prevention and not eviction prevention. Mindy's going to put some resources in the chat on that distinction as how the Alliance sees it for you to refer to. But remember, the focus here is on how to reduce literal homelessness. If you want to prevent homelessness, use funds in the Emergency Rental Assistance Program, the Coronavirus Relief Funds, the American Rescue Plan Act Utility Assistance Funds, TANF Emergency Assistance Funds, and other funds. There are billions more dollars in those programs to prevent homelessness. Plus, since by far the majority of people who are evicted or leave their housing do not become homeless, and we can't really predict who will, you are very unlikely to reduce homelessness if you use homeless funds for prevention. Next slide. So some recommendations. We want to act with urgency. Next slide. So we're going to hear more from Kelly and Fatima, but just want to stress again the importance of creating solid partnerships between the continuums of care and your public housing authorities, as well as healthcare. We know that there's a lot of concern about the EHVs and being able to use them and pairing them with services that will support folks to stabilize them in housing. So it's important to know, again, what role do each of you play, identifying what gifts and talents and skills you bring to that relationship, and the experience you bring to the table to have the most impact that you can in the successful implementation of these EHVs. So it's important to identify who's going to do what, who's going to have the housing navigation role, who's going to be responsible for connecting to services and making sure that those folks receiving the vouchers are connected to services. And it's really important to address concerns, being very transparent about what your concerns are. You can imagine communities don't want to burn bridges with landlords. You want to be able to connect households to services to stabilize and ensure that you're employing those best practices in housing navigation so that process is seamless from referral all the way to housing placement. And the importance of leveraging healthcare partnerships. Many of your communities already, and if you haven't, we're created partnerships with healthcare organizations in response to the pandemic. Leverage those partnerships now for the effective implementation of these EHVs. Next slide. So we want to do this and we want to do it fast. We want to ensure your partnerships are supported with a structure and a process that makes sure prioritized households are ready to go, that they assist in getting households leased up quickly, and again, that those partnerships are utilized and strengthened with service providers, especially those in healthcare. So it's a lot to do. It's a lot to do fast. And as we were talking about before, you just have to start meeting with folks, start figuring out what needs to be done to move people from unsheltered and sheltered homelessness to permanent housing. So enough from the Alliance. Let's hear how this is actually happening on the ground. We are going to have a facilitated conversation with our panelists, Kelly King-Horne and Fatima, about what's happening to better understand how communities can effectively put these EHVs into action. So, Mindy, next slide. So I'm going to ask Kelly and Fatima just a whole bunch of questions that we have gleaned from our conversations with communities and what we understand are the concerns out there through this EHV rollout. And after we have a chance to talk to Kelly and Fatima, we're going to open it up for Q&A. So we will have some time for you to put some Q&A questions in the Q&A. So I'm going to start off, Kelly, first to you. Can you tell us about the current state of homelessness in your continuum of care? Just the numbers you're seeing now and historically, and just share with us a little bit about the progress you all have made and where you still need some work on how to move the needle.
Sure. Yeah. Thanks, Kristi. And I'm excited to be here with our partners from RRHA. I'll just say that at the beginning and just assume it's true throughout. So we are a multi-jurisdictional continuum of care. We cover the capital of Virginia and 7 surrounding counties. Our point in time count, so our metro population is 1.2 million. So for our continuum of care, it's 1.2 million. Our point in time count in 2021 was 838, which was a 50% increase from 2020. So we had seen historic declines since really we started tracking data in the same way since 2007 and 2009. We have really moved to a housing focused system. And in the last 6 or 7 years, we've been really diversion oriented. So we start with trying to help people stay safely where they are. But we did see a big increase because of the pandemic. We also really worked hard so that people could have safe indoor accommodations during the pandemic. And so that drove some of that increase. We are big believers in rapid rehousing. We often use rapid rehousing because we don't have a lot of permanent supportive housing. But we really look at as a system, what are all the different pieces, how do they all fit together? And really we've taken some opportunities, especially with our partners at RHA, using targeted vouchers to relieve pressure on one part of our system so that we can get movement someplace else. And we use mainstream vouchers in this way. And because of that, we've seen a slight uptick in permanent supportive housing openings. And we're really looking forward to that with the emergency housing vouchers. And one thing I'll say, really working with our continuum of care providers, one thing that we've done to sort of ground this work in equity is offer a training on implicit bias for providers. And that was a 2-part training, and really just, keeping that top of mind. And so that concluded this morning, actually.
Oh, that's great. That's fantastic. Yeah, and I know that Virginia, Michelle has also talked about the intentional strategic training that they've been doing, even in the balance of state continuums on racial equity. So it sounds like that's happening statewide, which is so important and so critical. So Kelly, can you tell us a little bit about what your current plan is for the EHVs and how you plan to prioritize them and why y'all decided on that prioritization plan?
Sure. So as soon as the notice was published, or even before, when we heard this was coming, we started working with RHA, again, because we have been doing some work together actually for quite a long time, and then really it's intensified with the mainstream vouchers. But we started by looking at our HMIS data and, seeing what is happening to people in our community who are experiencing homelessness. Where do they get stuck? Where are they coming from? And what would be most helpful? We do year-round system planning. So of course we're a Medicaid expansion state, super exciting. And, just looking at how do we continue to build on that partnership. But we also, throughout the pandemic, have been doing focus groups with people staying in our pandemic response shelters, with providers, really trying to, understand our new reality and plan for new resources coming down the line. We, as I mentioned, have been doing work throughout the pandemic with RHA, and Tammy has also joined us, right, to get mainstream vouchers out. And we really targeted those as a move on because we wanted to free up resources. We do use rapid rehousing in our community sort of in lieu of permanent supportive housing. So we've taken that approach to really help people move through our system. And where we are finalizing our MOU. We still have the details to work out on the service provision, but we started engaging the providers, over a month ago to say, hey, these are coming. How many households do you think might, benefit from this voucher? Would you be able to help them? And so we've been doing a lot of the planning. We haven't finalized all of it yet. We also do have 2 other smaller housing authorities that we're working with. But the things we've put in place, so based on our HMIS data and all of the focus groups and surveys and meetings we've had, our Continuum of Care Board approved a prioritization plan on Monday of this week. And I can quickly share those.
Sure. Yeah.
So our top priority is to do move on for people in HUD-funded permanent supportive housing who no longer need supportive services or who have have access to the case management and supports they need through another system, Medicaid or some other, mental health provider. So that's our top priority. And, we did some of this with our mainstream vouchers, but there were age limitations and some other factors. And so, we've had a sort of trial run on what this looks like. So that's hoping to do even more with the emergency housing vouchers. Our second priority are people who are experiencing chronic homelessness, again, who either don't need supportive services or have another resource, right? because we don't have funding to provide ongoing support services, although we're still working on that, you know, really making sure that these vouchers are useful and that we're going to free up other resources, like free up HUD-funded PSH. We are looking at rapid rehousing because we use it sort of as PSH. So, you know, that would be our third category. And then the final one is long-term shelter stayers, which we defined as someone who has had 2 or more shelter stays in the last 3 years or stays longer than 45 days.
Okay.
And so those are our priority limits. We also worked with our domestic violence collaborative partners, and we looked at our annual data and sort of did a set aside and let that collaborative determine what's the best use for those households. And they've determined vulnerability within the population they're serving. And they're looking at things like, you know, length of victimization, length of homelessness, things like that. And so we're really partnering with them on prioritization. And then on process, the key piece that we have in place is that we have a dedicated coordinated entry staffer who is the main point of contact with providers and then partnering with our housing authority. And so Shawanda, you know, works to understand the application, the paperwork, which is all digital. So, right, but to really understand that process. So we are giving good referrals and reducing that lag time of back and forth, or I'm still waiting on this or waiting on that. And then the RHA has a dedicated person. And so those are the key pieces we have in place so far.
That's awesome. Thanks, Kelly, for running through that. That's so helpful. And I'm glad to have just community example for folks to kind of hear how you all arrived at that, the process, the structure, and why you chose the prioritization populations that you did. So I'm going to shift a little bit first. And before I do that, I want to welcome Tammy Grubb, who is here from the Richmond Housing Authority. Tammy, it's so nice to have you. Thanks for joining us. So this question is, yeah, excellent. So this question is for you, Fatima. Tell us about the historic role that the Richmond Housing Authority it has had in ending homelessness in Richmond. You know, previous partnerships with the COC. Yeah, just want to hear a little bit about what your role has been historically.
Hi, everybody. So we like to refer to ourselves as the largest landlord in the city because we offer all of the public housing units, as well as we administer the Housing Choice Voucher program as well throughout the city of Richmond. We've had a long-lasting relationship with Kelly and her team over at Homeward. We've had a current MOU in place, I think, since like early 2008, 2009, which prioritize families that are living in their shelters for our public housing units. So fast forward to now, and we are receiving all these specialty vouchers is like the thing now, so that we can give our families more options, more so than just our public housing units that's throughout the city. This gives them opportunities to find their own housing, put themselves in communities of better opportunities for them and their families. And so we've been working, I've been with the agency 13 years, and since I've been there, I was assigned to the Homeward program. So I was responsible for, when I was my eligibility specialist, for all of those referrals that we would receive from Homeward. And I would make sure that those families were housed within 14 days into a public housing unit. So we've been trying to do our part here in the city with ending homelessness any way that we can, whether it is through a housing choice voucher, a public housing unit, how we can. So.
That's great. I mean, you know, one of the things, the takeaways I'm getting right now, or what the takeaways I think is, you all already had a relationship, right? And I think for some communities, this is going to be the beginning of their meaningful resourced partnership with PHAs, and it's going to be a slog. It can have moments of joy and moments of tears, but one of the things that seems very important is that you were able to move quickly on this because you already had a relationship. And so getting that relationship started, if you haven't had it, is the most critical step. But also, this is what I'm excited about, is that this is the beginning of hopefully what is built will be long-term relationships.
Right. And it's just a matter of getting started, getting all of those people that need to be at the table. Everybody has the same goal. All of us want to help these families, and all of us are working towards the same goal. So let's just get the people that need to make this happen at the table, and have the discussion, and to see how we can all, make it happen. Like Kelly, we would have round tables. We would bring all of our partners and everyone in, and we would do that regularly if we needed to see who needs what, where we're seeing, the issues and things like that. So it's just a matter of just getting it started.
Yeah, I'm going to say absolutely. I think, for people who don't yet have a relationship, doing a project like this together is the way to get it done, right? I mean, and maybe start with introductions. I remember one of the things that was key to our partnership building was that this was years ago, maybe, and one of the national groups offered like a co-convening of public housing authorities and continuums of care. And basically it was like, here's a public housing 101, here's a continuum of care 101. So do that, doesn't have to take a lot. And then actually like reading the notice for these vouchers really lays out, okay, you should do a training. This is what coordinated entry is. This is what it means for us. Here's our data. And being clear, like, this is what we can offer, and this is how we would do it. So.
Well, I guess piggybacking up on that, Kelly, can you just again, I love the dedicated staff on both ends. That sounds also very critical. But just for clarity, so what is the role of the COC in the partnership? And then Fatima, to you, what is the role of the PHA? Like, who's doing the housing navigation? What is your MOU saying? Like, how are these roles moving the needle on making homelessness for everybody from one time?
So Fatima, I'll start, and then so we're still finalizing the exactly how the housing search and that navigation will go. It's likely to be primarily done by the continuum of care providers who are already working with households, because we are using these vouchers as part of a system-wide approach, and really, targeting this resource, targeting other resources, which is why it fits in coordinated entry to, make the best use of these vouchers and get, more sort of movement for our neighbors experiencing homelessness. And so the dedicated person, what's so important about this is that, she has time to learn the regs and the rules and the requirements, right? I mean, one of the key things in a partnership like this is understanding that both sort of systems or agencies have a different framework, we have different language, we have different requirements or definitions of success. And so to know, like, what kind of paperwork do we need, to meet the requirement? We want RHA to be successful, because if they lease up quickly, we can get more vouchers and we could house more people together. And so having that dedicated person to really understand what's required, how it works. So that's the key for us is, so that's part of her job. The other part is then interfacing with providers. So we don't have 10 or 15 case managers asking the same question over and over. If we identify like, hey, everyone has this question, then we ask, Fatima and her staff to do a Q&A session with the partners, and that's really successful. But we can sort of herd those cats here, and I say that lovingly because they're amazing, right? And then, make sure we know, like, what does RHA need from us, to help these households move quickly. And so that's what the continuum of care does. And then again, it's looking at all the people in our system with our prioritization and just, making those referrals. And we're since the board passed prioritization on Monday, we've already got our PSH agencies, looking at their caseloads, so we can make referrals. Tammy's waiting for the referrals like today, and we're like, okay, we're working on it.
Yes, we want them tomorrow.
Working on it.
Fatima, did you want to add anything to that?
We kind of covered it all. So like, once we get the ball from their team, then our team is ready to begin the eligibility piece. And so what we kind of do on our end is make sure that they are document ready, you know, IDs, birth certificates, social security cards, proof of income, all of those things that they are ready, and we begin the eligibility piece. We also provide, you know, the briefing and everything till that the families are successful when they do receive the voucher to go out and to find housing. So it's streamlining of processing. You know, once Kelly team hands it over to us, then we pick it up, and then we kind of begin eligibility, and then kind of give the families and the individuals the information that they need to go out and to use the voucher.
And what we've also added for the emergency housing vouchers, we will have a dedicated person for eligibility, as well as a dedicated person to process the leasing packets as they come in for affordability, so they won't fall into the pipeline of all of our other voucher holders that are searching. So we will have an eligibility specialist as well as a dedicated leasing specialist to lease the families up in the as quick as possible in that time frame.
That's awesome, Tammy. Thanks for adding that. So it sounds streamlined process and getting the referrals, the matching, getting folks leased up. So I'm going to shift gears.
And then wait, and then tracking, right, Kristi? The other piece is tracking, and we're working on a new spreadsheet to monitor, like, what stage in the process are people, like, do they get stuck? So as Tammy mentioned, that lease up, how many people are searching? Do we need to sort of, do some, group thinking on how do we speed that up? I mean, I think that's the other piece, is monitoring what's important for all the partners and for the people being served.
Right, exactly. With that goal of getting people into housing quickly. Yeah. Yes, I think, it'll be really interesting when this is, when we get through this round of vouchers, like the lessons learned in how quickly, and to further opportunities in the future. So all these communities that don't have partnerships with PHAs on the mainstream vouchers will now have something that they can go and propose to PHAs for that. So I want to get to a question. Definitely one of the biggest concerns we are hearing from communities is around not having access to adequate services for people with high needs or disabilities. Can you talk about the work you all are doing or have previously done to create healthcare partnerships, and how that system may or may not be used to utilize to support these EHVs?
So, we have done a lot of work with our managed care organizations. We've been working to educate. We've had a number of meetings with managed care representatives to just talk about, what we do, what they do, how we could do it. We've talked about data sharing. And part of that is that in Virginia, we have a new Medicaid benefit coming online next year, which will be housing supports. So we've really, for over a year now, been prepping for that. And we have, through the pandemic, partnered on specific cases where, it was actually an MCO staff person who helped one of our highest need persons, early in the pandemic, right? And so it's really that individualized partnership and case management. But I also say, for our community, what makes sense is to use we were really clear in our prioritization to target people for this resource who have supportive services from another resource, so that they, because many people in our community they have multiple case managers. And so knowing that is important. Our mental health authority does provide a lot of services for people. And so really understanding and having conversations with those households to see what their needs are. Are they comfortable? What does that look like? So those conversations are ongoing so that we can target these resources, because this is not permanent supportive housing, but if we do this right, it frees up permanent supportive housing. So it's really looking as a whole. I mean, still serving people, who are highly vulnerable, right? Which is why our order prioritization is in place, but taking a broader view. Not every resource is the same, but not everyone needs the same resource. So that's how we're approaching this. And then it's really working with our continuum of care providers, whether it's a permanent supportive housing provider, rapid rehousing, shelter case management, or, street outreach, who know the individuals and households. And, that's why we started working with our providers, to start thinking about it. Look at your, caseloads and see, this is what we know about EHV, start thinking about how would you, who could this work for, right? And then what can we do once we get these in place?
Awesome, thank you. We're gonna just a few more questions, and then we're gonna open it up to there definitely lots of great questions that have come into the Q&A. But so it sounds like you all have well, not just sounds like, I know you all have strong and long-term partnerships with each other. So I know you can be honest with each other and honest with our folks who are here on the webinar. And this is to all of you. What is the biggest challenge in working with Fatima and Tammy, with the COC, or Kelly with the PHA, respectively? Like what's the biggest challenge, and what strategy have you come up with to overcome those challenges? Because it seems like the benefit of working together definitely outweighs the challenges. I can hear that. But just yeah, what are the challenges, and how do you address them?
I guess we won't all go first. We'll say we don't have any challenges. No, just kidding. Like, honestly, to date, we don't. We did have to take the time to learn one another, to learn each agency, and to respect one another's regulations and guidelines and timeframes and turnaround times, because everyone wants this and we want it fast and we want the turnover, but we want it to be done correctly too. And so once we realized that we had to kind of streamline it a little, and how we have a designated person, because in the very beginning, we were getting referrals from everywhere. And we had, we were trying to manage it. And so this process has come over time, and we realized what worked and what didn't work. And so when we designated one liaison that's coming out of Kelly's camp, and then we have the one specialist here over at our camp, and now we're adding the one leasing specialist, so that it's all streamlined and it's not coming in from so many different directions. So that was our biggest challenge in the beginning. Honestly, and I'm not just saying that just to say it, like to date, we don't have very many, because we've kind of, worked out all the little kinks along the way.
Yeah, I mean, and I think it is key. Like we, it was taking the time to understand what success looked like, right? And especially for COCs, like we all have expectations of like, oh, that PHA should do X, Y, and Z, right? And, but it's really like, what's realistic, right? I mean, because like, they can't do everything, and they have requirements as well as we do, right? And so, it was really like with the mainstream vouchers, which was sort of how we got ready for this, how we worked out those kinks. It was going through the packet and like step by step with the housing navigators who would be supporting households, right? Which is the same framework we'll use for these. Like, okay, we need this document, and here's the options you can do to meet it. What do we need? Like, what does it look like? What form is acceptable? So it was really going through those details with providers and the ability to answer questions, and then repeating that as needed, right? I mean, I think that's been key, is like, okay, what does it really take to get, someone, to get a good referral packet, make sure we knew, that someone was eligible. And, we missed one, we made a mistake. So like, okay, how do we fix that? And make sure that we are, making a good use of our time and these resources, and setting up our neighbors to be successful in leasing up.
Yeah, I mean, I guess what I'm hearing, being smart and strategic. I mean, if you don't do that, get down into the minutia. I think it's just a great example. Like, let's take the packet. Like, let's work through. Is everybody on the same page about what everything means on these pieces of paper? Because in the end, you're going to end up doing that anyway. If you don't do it at the beginning, it's just going to be chaotic and frustrating, I'm sure, and a lot of assumptions being made. So maybe just doing that from the very
beginning. We literally did a Q&A. I had about maybe 70, I think, different like housing navigators, and we went page by page, like via Zoom on, some of the because I wanted to know what the hiccups were, like where are we getting hung up and what's giving us the most issues when trying to get the packet completing, or, things like that. And so we literally had a session on how to complete the packet and what are acceptable verifications, what waivers are in place that we can use in place if a person doesn't have a birth certificate or a current social security card, because we want them to be successful. And so that's what we used. And and I wanted to know what they need from us. Like, how can we be of better assistance? And they told us what they needed, and that's what we did.
Awesome. So one from all three of you, or whoever wants to, one piece of advice to our participants of the webinar moving forward, and then we're going to move on to Q&A. One piece of advice that you would give as they move forward in their respective partnerships
Well,
to make
for
these
me,
successful.
the open line of communication between the two partners. So if you don't understand something, knowing I can contact the partner to figure it out of how we can go about working with this client or assisting. Can we change something to help them lease up? So just the biggest thing is open line of communication.
Thanks, Tammy.
I mean, I'll just say, like, take time to learn what each other does, right? I mean, it's really important work, and no single agency or system can solve the crisis of homelessness. So, knowing and respecting their partners goes a long way to really understand, like, oh, you're under that pressure. Well, we can, work through it this way.
Yeah.
Great.
I would just say to know that we're all on the same team. It's not a competition. Like, we're all working towards the same goal to, try to best assist our families. So sometimes we have to take a minute to listen, and we have to listen to understand and not listen to respond, because sometimes our peers know more than we do, and we think we're doing it one way and in our way is the right way, and it's not always the right way. So just like understanding that we all have the same goal, we're all on the same team. It's, like we're all trying to get to the same place kind of thing.
Awesome. Wonderful. Well, I'm gonna, before we move on to the Q&A, I just want to thank the three of you for your time, your energy, your dedication in your community, because it is obviously making a difference in the lives of people and ending their homelessness. And so just again, thank you for your time and being here with us today. It's always great to hear what's going on in Richmond. So I'm going to jump in to some questions. We have about 15 minutes or maybe 13. And so the first question is, vouchers are terrific, but have little value without inventory. How are you leaving the recipients responsibility to find housing, or are you actively involved in finding available units? What can you share with a provider in a very hot housing market?
So we're in a hot housing market, which has only gotten tighter through the pandemic. And so part of our strategy of using a move on strategy is really, there are some people who are in housing, and then we can free them up, to do the next housing search. But it is really working with the housing navigator staff and equipping them, so that they know, like, what units are going to pass inspection, what's rent reasonableness. And so first, it's making sure that your search is fruitful. And understanding, another partner at RHA is a big believer in shared housing. And so she's helped us to understand how can we expand that housing search. But it's really, really hard. And we continue to do it every day. You just have to keep going. One of our providers who does rapid rehousing and serves households with minor children has banned her staff from saying, oh, there's no housing. Just like, it's not helpful to constantly live in the space of it's not possible. And when you sort of stop thinking about that, it frees you up to focus on what is possible. But it's those dedicated staff members and using those existing networks. It's not easy though. I'm not saying it's not easy. Our vacancy rate got to 0.5% last year. And
I just know on our end, Tammy is constantly working on landlord outreach. And with especially with these vouchers, and if we're able to provide incentives and things like that. But she is currently working on a landlord outreach campaign right now for the EHV as well as for our other vouchers. So we're always constantly trying to get our name out there, our face out there. It's a little bit of rebranding because some people have their own interpretation of us or what a voucher is and what it provides and what it brings to your neighborhood and things like that. So Tammy is coming up with a campaign to try to combat against that and to let them know that that's not the program that that you once heard of, kind of thing. So landlord outreach is one of the bigger things that we are working on right now.
We definitely are. And with the emergency housing vouchers, we will be using a lot of the funds that we're able to assist with security deposits. As landlord, we will provide landlord incentives if they lease to our emergency housing voucher participants. And we will assist with application fees. So we do have a list of items that we're going to assist to help with the process of leasing. But we do have to get savvy with our landlord recruitment. It is a hot market, so we're working on that.
That's awesome. And Tammy, you just actually answered the second question I had, which was, are you planning to utilize the service funds given with each?
Definitely.
That's
definitely
fantastic. So can you also, another question was about how are you paying these additional staff, these dedicated staff? Like, is this a position, maybe you can't answer some of this right now, but is this a position just envisioned for this time with EHVs? I mean, it sounds like a lot of investment in some really good structure and process. So how did you come about that? How are you funding those?
So for our leasing, the new leasing specialist, it will be a temporary position during the lease up phase, but we will be using the funds that HUD is granting for the emergency housing vouchers. For that, our eligibility specialist is already on board as a permanent staff member. So we're gonna kind of use both the funding that we already have in place and the funding that they'll be giving out for the emergency housing vouchers.
So, all right. Let's see. This is a clarification question for you, Kelly. Coordinate and answer question regarding prioritization. Will you first refer all those in priority 1 move on, then to chronic at a point in time? I'm not sure.
So, well, we're working through, we just passed prioritization on Monday. And so we're working through the logistics of how that will happen. But we think we're going to start right away with our move on, households,
Okay.
just because that'll be quicker. I mean, it's a little bit easy. There's not quite the same housing search. It's not likely to be a housing search because these are scattered site permanent supportive housing, which is a key piece, right? So they're already in community-based housing and no longer need those supportive services because we have some really old PSH grants, right? And we've been looking for this opportunity to free up those HUD funds for people who need ongoing, more robust supportive services. And then we'll be working through what that process looks like, and then taking a little bit of time, to work through any tweaks, and then we may not be as so rigid once we figure out the move on pieces. We may not be as rigid, among the other categories. So.
And Kelly, I know you all do such a great job of putting your like COC stuff on the website. Are you going to make public at some point, since it's been adopted by the governance board, your prioritization? Is that going to be available on your website?
Yes, it will be.
Okay. Great. Okay. Okay. So definitely there are some questions still concerning how to connect services and addressing the concern about serving folks. Basically, how are you all addressing concerns in your community, if there are, about serving folks who are perceived to need more services, that they'll only be successful if they have those support services versus not? Basically.
So let me just stop you right there, Kristi, right? So, I mean, part of it is it's differentiating between your perception and what a household needs, right? I mean, the reality is we don't have enough housing resources or housing interventions in our community. And, we're serving people inappropriately now, right? Quite frankly, we're using rapid rehousing, instead of permanent supportive housing. And so part of our strategy is if we can, free up permanent supportive housing, then we can help people get the intervention that they really need and what they tell us. And sometimes it changes. I think it's a lot of conversations, right? This is what, this is the heart of the case management of a person-centered response to homelessness. You know, and really making sure that, you know, it's not just getting someone in housing and then walking away. It's making sure that they have a plan. You know, what are those, you know, next steps? You know, do you have healthcare, right? And we partner with our healthcare for the homeless clinic. They're amazing.
Right.
You know, making sure that people know how to find out about other resources, making sure they're connected to food or workforce. Or whatever, you know, else they might need. So that's part of the housing plan is, okay, what happens next? You know, and then it's, you know, again, we're not going to put someone like, this isn't permanent supportive housing. This is going to help us get more permanent supportive housing, right? So it's being really clear about that, but it's the conversations with the, you know, individual household. And then it's the planning for the next steps.
Okay.
And I do, yeah.
Okay. No, you go.
I mean, I think the other piece, you know, that we haven't highlighted as much, you know, one thing that, you know, our public housing authority is, you know, excellent. Like, I can't say, like, I advise everyone to read the notice on emergency housing vouchers if they want to like cry over good federal policy, right? Of how it integrated homeless assistance and housing vouchers. It's beautiful. And I hope for more. But I gotta say, I glazed over some of the like waivers and some of those details because I knew that our RHA folks would pick that up. So that might, you know, so maybe having them talk about that process, because they're the experts there.
Yeah, great. Actually, Mindy's throwing me excellent questions in this. And now as we kind of come to the wrap up, you know, I'm finally getting my groove here. So Fatima and Tammy, maybe you could talk about that. Like, how are you using the waivers that are available to overcome some of these barriers around, you know, birth certificates, IDs, you know, using it to create that buy-in?
We've been a little bit creative, lenient. I mean, just for an example, if a family has an ID that is expired, but they can provide us proof that they have a DMV appointment to go in and have the ID, you know, the non-expired ID updated, we're willing to take that. We're not, with just the Social Security cards, willing to accept the Social Security printout in place of that, with the verification of knowing that you have placed an order for the Social Security cards. So we are trying to be as lenient as possible, use waivers where we can, because we don't want to hinder families from being able to get into housing. And a lot of these agencies aren't open, from my understanding. You know, like Social Security is not open to the public. It is by appointment only, or they're physically asking them to mail their ID and things like that in the mail with like a 6-week turnaround time. So we are utilizing waivers where we can.
Awesome. I mean, so I think that's a great place to kind of wrap this up, which is maybe a word from you as a PHA to the PHAs out there that may be struggling or not really wanting to serve the population, the homeless population, and any advice that you would have to give them as kind of parting words, because it really sounds like you are screening people in and not screening people out. This is, you know, the difference between people living unsheltered homelessness, sheltered homelessness, which is, as we know, is filled with trauma. I mean, the difference between your approach in ensuring success for these households is critical. So any parting words you have for some PHAs that might be a little hesitant to engage this population?
I just say sometimes we just have to remember why we got into our jobs, and why we're here, and what's our goal. And so our goal, you know, is everyone has a right to have, you know, suitable living conditions and a home to live in, you know, to go into. And so I just think that we have to remember why we're here and why we do what we do every day, and that it's a right for everyone to at least have a home and a roof over their head. And so any little thing that I can do or my team can do to make that easier for someone in their family. And you never realize the difference that you make in someone's path into gaining housing. And so just in the time that I've been here and as young as I am, I have a lady that sends me a Christmas card every year who tells me that she was escaping domestic violence. And she thanks me every year for allowing her to come into my office and to close the door and to cry, but I put her into housing. She's like, you may not even remember my face, but I tell everybody about you. And so sometimes you just have to remember those little things. And, you know, while it may just seem like paper to you, that you're making a difference in somebody else's life. And your little step, you know, that little spot where they met you could change the trajectory of where they're going. So I think that it doesn't hurt anything to try it. Like, what do you lose? Like, what do you do? What do you lose?
I'm not even going to add it anymore because this is a perfect way to wrap up this webinar. Thank you so much, Fatima, for your energy, your inspiration. Kelly and Tammy, you too, thank you so much. On the screen, you can see this is our contact information. If you have any follow-up questions, please let us know. Also, in particular, if you have other topics you would like to see the Alliance cover in the series of webinars, please do email me at my email there, Kristi Schulenberg at naeh.org. We are, as we shared earlier, putting on a series of webinars. Mindy sent out the link to the website where you can access yesterday's webinar. We will have this webinar up and ready to go in the next day or two. We will have some takeaway documents. And Kelly, if you don't object, we'll make sure to just keep on top of when you publish your prioritization, and we'll put a link to that on our website when it's up and ready. Thank you so much, the three of you. Thank you, Mindy, for all the technical assistance you've provided behind the scenes. And we thank you all for joining us today. Have a great day. Goodbye.
Thank you. Bye-bye.